We've not done a good job of explaining what these vaccines are, what they might be able to do, and why people need to get them. So we've got to get that done too.
Well, good morning and welcome to Washington Post Live. I'm Paige Winfield Cunningham, author of the Health 202 newsletter here at the Washington Post. And this morning, I'm pleased to welcome as my guest Dr. Michael Osterholm, an infectious disease expert at the University of Minnesota. And he's also on the advisory board that is advising President-elect Joe Biden on COVID-19 during the transition time. Welcome, Dr. Osterholm.
Thank you very much. Good to be with you, Paige.
I know you and I have been in touch throughout this pandemic, and I've really benefited from your insights. And I know we have a lot to get to this morning. But first, I want to ask you about an announcement we saw from Biden late last week, saying that it is his plan to immediately distribute all vaccine doses instead of holding half of them back to ensure everyone who gets that first shot can get the second. Can you explain the reasoning behind this decision and why you think it might be a better approach here?
Well, first of all, let me just be really clear here. I'm very honored to have been serving as an advisor on the advisory board to the president-elect and vice president-elect, but I surely don't speak for the transition team. But let me tell you what I see happening here is the transition team has been very clear about science will, in fact, rule the day for how these vaccines are used, when they're used, where, et cetera. And so let's first of all just clarify there is absolutely no deviation from the need for a second dose at the appropriate time. And they've made that very, very clear. So this is not like the situation in England where they have decided to postpone doses. That's been a rumor that's been out there that there is going to be some deviation from that. There is not. The science will, in fact, determine when vaccines are to be given. Second of all, is when the program was set up, there was literally a plan to hold every second dose until it is needed, as opposed to actually mixing, you might say, some of those second doses that could be given earlier as a first dose, and then allowing the increasing capacity and manufacturing to cover for the second dose and the new first doses. So, what the Biden team has done, I think very wisely, has said we don't need to hold all those second doses. At this point, we know that the capacity is going to increase, but we can plan for if there is some challenge to a one lot, for example, where a sterility problem may come up or a manufacturing glitch. We can actually come up with a strategic reserve of that vaccine so that we can still meet the needs of second doses. So the truth of this whole situation is somewhere between the two extremes that people have been presenting. That in fact all doses will get released, or that it'll just stay the same. And I think they have very wisely measured what we can surely expect vaccine delivery to be, take into account a possible glitch in manufacturing, and still have enough doses. So you're going to see more doses out there, but it won't be all of them.
So it sounds like what you're saying is there's an idea of putting some of this into a reserve, and I'm hoping you could elaborate a little bit more on that. And then what about people that are concerned that if they get that first shot, that then there's not going to be enough supply for them to get the second shot?
Well, let me answer the second question first. This is really important. The incoming administration is planning very carefully to make sure that that second shot is delivered on time. And so please, at this point, do not be concerned about that. I'm very confident that the plans cover that. Again, when I talk about holding back vaccine, uh, the incoming administration and the transition team has done a very, very careful review of what the manufacturing capacity is now, what it will be likely in 30 to 60 days, and how you plan then for both accommodating an increasing number of first doses as well as having enough vaccine as backup insurance, you might say, so that should a particular lot of the vaccine not come through at the scheduled time, that we can still cover the first and second dose situation. So I'm very confident that what they're talking about doing is exactly what I think is the best science. Get as much vaccine as you can out first doses. Have your uh, ability to make sure you can deliver on second doses, even if something should happen. We don't anticipate it to happen. But at the same time, don't hold all second doses and wait 3 to 4 weeks. So I think that's a very a good plan that's based on good science, based on good numbers, and I'm very confident that it will yield ultimately the most protection for Americans as quickly as possible.
I think there's also a lot of confusion on what the science says here. I've had people tell me that we don't have much protection at all after the first shot. Some people think we do. Can you lay out for us what we know of what the science says about that at this point?
Well, I think it's been very clear from the information presented by NIH researchers, the FDA, the companies that are doing the work, that there is a protection that can occur very shortly after the first dose. It's a limited protection in terms of numbers. We don't have the data to support how long that protection might last after the first dose, and that the second dose with these two currently licensed vaccines, or I should say emergency use authorization approved vaccines, really does require that second dose to assure that there is the robust response that not just for long term, but even in the weeks following the first dose. So I think that, again, as you've heard from NIH officials, you've heard from the FDA officials, I think that the incoming administration is taking the science again. That's one of the things I've been really impressed on, and being part of this advisory board. Science will rule the day. And the best science data we say says you need these two doses.
We've also obviously everyone's concerned about the ramp up of vaccines and the speed. It seems like there's been relative success in getting the vaccines shipped out, but then there's a lot of hang up in actually getting them administered, at the hospital level, at the health provider level. Where do you see the biggest problems here? Is it in sort of just the mechanics of getting the shots in people's arms? Is it that not enough people are coming? And also, I know this probably varies regionally. We have different things happening in different states.
Well, let me kind of try to take this in parts because this is complicated. Um, First of all, I've been concerned about this for some time. As you know, I did a podcast in my weekly podcast over a month ago entitled "The Last Mile and the Last Inch," raising concerns that Operation Warp Speed has been a tremendous success from the standpoint of developing, researching, manufacturing, and getting these vaccines to the regulatory process. But it's like building that bridge over a 3-mile gorge that was a great bridge up until the last 100 feet, and then nothing was left for that, and the bridge kind of is a problem. What we saw happen was very little attention paid to how to deliver these vaccines and how to use them. And part of that was that there just wasn't support for what goes on at the local level by state and local health departments, which generally oversee the vast majority of immunizations that occur. Just remember that right now, the two program areas that are being prioritized are long-term care facilities through a contract between two pharmacy companies and the federal government, not in the purview of the state or local health departments. That program has been very slow to get started here in our own state. We're way behind because these private companies have not delivered as was anticipated. The same thing in terms of healthcare facilities with the holidays, and on top of that, with the situation of the increased number of cases in many healthcare facilities around the country, where it's very stressful to try to get just medical care done, let alone immunizations. This has been relatively slow. This is the first 25 million people that need to get vaccinated. Now, those recommendations for vaccinating those two groups came from what we call the Advisory Committee on Immunization Practices from the CDC, general guidelines, not mandatory requirements. Some states have decided, well, you know what, we're going to actually go by age. We're going to look at those 65 years of age and older and include those. Remember, you only have a limited supply of vaccine. So, if you're going to, basically make that decision right now, then you're going to be taking it away from potentially long-term care facility residents or the people who work in our healthcare side of the house, which is very important to get them vaccine. So there is no easy answers here. Until you have more vaccine, which is coming, it's going to be a challenge. So I think what you're going to see, though, is as state and local health departments finally get resources. Remember, they've had no resources to do this. Only now is the money flowing from the recent passed bill to bring the first $3 billion out there to help state and local health departments oversee what needs to be done. Now, I will say that I also, again, I think the incoming administration gets this. They really understand this, like unlike the current administration's efforts. And what I'm also very pleased with is they're going to make available to states all the federal resources possible. And you've heard the president-elect talk about the National Guard or pharmacy programs, et cetera, but they'll do it in coordination and collaboration with the states. I've said this all of my career, like politics, all public health is local. How you deliver a vaccine in a county in California may be very different than how you deliver it here in Minnesota or how you deliver it in the state of New York. And public health agencies understand that. And so I think what you're going to see is as vaccine becomes available, a much smoother, still not always completely smooth, but smoother transition to making vaccine available to people who know when to get it, where to get it, how to get it, and why they should get it.
Well, and you're right, this is so complicated. It has seemed like in theory this plan would work, right? The state health departments, public health departments were supposed to coordinate with the providers and then get the vaccine directed there. And yet we are seeing a lot of concern from providers that this isn't working very smoothly. In fact, the American Hospital Association sent a letter to HHS last week asking for more federal direction and communication to assist with the rollout. How do you think the administration could respond to these particular concerns from hospitals? How might things look different in terms of the communication under the Biden administration compared to how things look now under Trump?
Well, first of all, as more vaccine becomes available, that will surely help everyone and everything. Okay, that by far is a major, major challenge for healthcare facilities, even where they don't have enough vaccine, or they can't always anticipate exactly how many doses they'll get on what date. That all raises a challenge. The second thing, let me just point out that I've been in this business for 45 years. I've been involved with a number of major vaccination campaigns, including the 2009 influenza pandemic. And there has never been a campaign to vaccinate the US population, anything like this. Remember, one of the vaccines has particularly stringent requirements around temperature so that it can only be used up to 5 days after it's taken out of the freezer. And then once it's constituted, it has to be used within 6 hours. And so to try to plan your immunization programs and to make sure you don't waste one precious drop of this vaccine has been a challenge second to none. That will continue, and we're going to have a challenge with that. But what I see right now is the incoming administration, and I have had an opportunity to participate in a number of these meetings, have been meeting routinely with leaders from public health, from the healthcare industry, from those who support the immunization programs through supplies. And there is a communication and an understanding of what the challenges are and what needs to be done, unlike anything I've seen before. So I am confident while there still are going to be challenges, make no mistake, this is not going to be a perfect rollout just by all the complicated issues involved here. But I think right now we're getting more and more people to be on the same delivery team with resources. And I think that's going to make a big difference.
There's also been a conversation about, do you prioritize just getting shots in people's arms as quickly as possible versus making sure that people sort of wait their turn and get it when recommended? I know that New York Governor Andrew Cuomo was criticized. There were, hundreds of thousands of vaccine doses that went unused because of these eligibility rules. What's your take on that? What should we be focused on? Is it making sure people wait their turn in line or getting the shots to people?
Well, I think this is one of those ones that, again, is just very complicated. Let me give you a case in point. Um, we have heard about what appears to be willy-nilly administration of this vaccine, particularly in the healthcare setting. And what I mean by that is that we have had situations where suddenly at 4 o'clock in the afternoon, people are literally running through hospitals to locate additional people to vaccinate that might not be at the highest priority level because of the fact that they now have 27 doses left and it's going to expire in several hours or less. It's almost like having this ticking kind of time bomb on your hand. You don't want to waste those doses. Now, if somebody were to see that, they would say that's really chaotic. That's just not fair. What's going on? Well, it's because of the way the vaccine is being delivered. On the other hand, we've seen healthcare facilities uh, prioritizing people who have very limited, if any, patient contact, people in the law offices of their institutions, et cetera. That's not right either. We need to make sure that we're getting this vaccine first and foremost to those people who are on the front lines. Those people are at risk of picking up the infection. So the healthcare facilities are themselves still trying to work out how to best allocate this. I have called for healthcare facilities to vaccinate 7 days a week. We know many of them right now are vaccinating 5 days a week. No, this is a national priority. Vaccinate 7 days a week to get this vaccine out. Let's hold them accountable. So I think that is important. On the other hand, let me be really clear. There have been a number of healthcare facilities, hospitals, clinics, and so forth in this country who have done an amazing job in the face of real pressure of just having so many people in the hospital working these long hours to save patients. So I think you're going to see, even in the healthcare side, this problem begin to resolve more as we figure out how to get it done. This is the planning I wish had gone on months ago. It's the problem that this new incoming administration is going to inherit. But I do believe again, and this is just me calling balls and strikes. Anyone who knows me knows, I've served roles in the last 5 presidential administrations, and my job is not partisan. It's just called balls and strikes. And I do believe that this incoming administration gets it, and I think that there will be a much more coordinated and smoother effort to get this vaccine out as quickly as possible, starting in January 20th.
There's, of course, a lot of questions about when we get the country to herd immunity, when we have enough people vaccinated so the virus isn't spreading so quickly. What daily rate do we need to reach here? We know that last weekend, I think it was up to 500,000. It seems as though it's fallen again, and some experts have said 1 or 2 million per day. But what do you think?
Well, if I had the power of a public health magic wand, I'd like to have about 8 billion people vaccinated by next weekend. Okay. This pandemic is extracting a terrible, terrible price around the world. We see it right here in this country. And I must tell you, I think our darkest days are still ahead of us potentially, both in terms of, I think we're going to continue to see case numbers go up. We now have what I call this adjusting baseline issue where basically we now accept having 220,000 cases a day, 3,000 deaths. That's not acceptable. And so we have to get this vaccine out as quickly as possible to as many people. One of the concerns I have, Paige, is that very little was done by the current administration to really understand what are people's fears about this vaccine? What are their hopes? We call this knowledge, attitudes, and beliefs. And we're already getting reports that 30 to 40% of healthcare workers are at this point taking a pass on the vaccine. Not saying that they're not going to get it, but they want to see more safety data. We've done a terrible job of trying to explain to the public and even our own healthcare providers what is Operation Warp Speed. What a terrible name. It makes it sound like somehow this vaccine was just roped through and without any real concern for safety. There were no safety steps at all shortened in this process. We've not understood, for example, why there may be communities out there, particularly in the Black community, that would have great hesitancy about a vaccine like this, that they think a political thumb may have been on the scale. I can tell you that the FDA on this issue with these vaccines did an outstanding job. The review was as critical and as comprehensive as you can imagine. I have great confidence in what they did, and the independent outside experts that were brought in to review this would tell you the same thing. But we've not done a good job. So one of the challenges we're going to have is not just having vaccine available, but making sure that we can get people to take the vaccine. I, for one, I've been here accused recently of not supporting the vaccine because I haven't gotten vaccinated yet. Well, I'm one of those people that my number hasn't come up yet. I'm not going to jump in front of the line. I can't wait for myself, my family, my friends, my colleagues to get vaccinated. We have to somehow translate that kind of excitement, that kind of trust into the general public and even our colleagues. And we've not done that yet.
Well, unfortunately, our time's growing short, but I do want to ask you this final question. How long do you think all of this is going to take? And I realize there are a lot of unknowns and moving parts, but when would you advise Americans that life in the US might start looking a little more normal?
Well, there's that old line out here in the Midwest, you can take a horse to water, but you can't teach it to drink. We can make all the vaccine available possible. This incoming administration can do everything it possibly can. But in the end, it's going to be about Americans deciding that they're going to take the vaccine because they believe one, the pandemic is real. Number two, it could be their life or the life of a loved one that they saved by getting the vaccine. And number three, that the safety issues, the concerns that they have, don't we're already seeing on social media, such disinformation coming out. Please know that the entire campaign, the entire effort is being based on science. And I think that's the most important message. So, depending on how that happens, Paige, it could be this summer, but it could be later if we don't are able to get people to get vaccine themselves.
Well, unfortunately, we're out of time, so we'll have to leave things there. But it was a fascinating discussion. Thank you so much, Dr. Osterholm, for joining us today.
Thank you. Thanks a lot. Get vaccinated.
Please come back and join us here today at 2 p.m. Eastern, where my colleague Jonathan Capehart will be speaking with California Secretary of State Alex Padilla. Padilla will be replacing Vice President-elect Kamala Harris as Senator from California, and you won't want to miss that conversation. I'm Paige Winfield Cunningham, and thanks so much for watching.